my name's Ashley Hahn. I'm a social worker here at Hearst Cancer Resource Center, and I'm going to share with you what I've learned over the years about sleep, and hopefully something will be helpful to you. Okay, so what I'm going to go over tonight is, this is our little agenda here. What is normal sleep? How do we define insomnia? The difference between sleepiness versus fatigue, sleep management techniques, that'll be the bulk of what we'll talk about, some relaxation techniques, and then some additional resources for you. So sleep compromises a third of our day. So very important piece of how our body and mind functions, rests, recovers. Sleep quality and quantity plays an important role in how we manage our physical, mental, and emotional health. In the United States, 1 in 3 adults report issues with insomnia. And for those facing cancer, those numbers are even higher. Sleep can be negatively impacted for cancer patients for a variety of reasons, including pain, discomfort, side effects of medications, treatments, stress, anxiety, and other health conditions. So, what is normal sleep? Everybody is different, but this is from the National Sleep Foundation. It gives you kind of a range because everybody's different. So you can see as you get older, it goes down. With some people, it says 5 to 6 hours may be appropriate. I would say shoot for the 7 to 8, right? That would be ideal. And then I also just want to make a point how just to normalize, waking up during the night. This does not mean consecutive hours of sleep, right? So it's very normal to wake up. A third of Americans report waking up on a regular basis, and nearly half of those people find it difficult to fall back asleep right away. Okay, so insomnia. What is insomnia? It's difficulty falling asleep or staying asleep or both. It can be acute or chronic. American Academy of Sleep Medicine reports approximately 30% of adults experience insomnia at some point in their life. 10 to 15% of adults experience chronic insomnia. And then, like I said before, reports of insomnia are higher among people facing cancer, maybe up to 3 times higher. So what is chronic insomnia? It's disrupted sleep that occurs at least 3 nights a week and lasts at least 3 months. So if a doctor is going to clinically diagnose you, that's the numbers that they're looking for. According to the American Psychiatric Association, there are other sleep disorders like insomnia, for instance, sleep apnea, hypersomnolence, narcolepsy, which is a neurological disorder, and restless leg syndrome. So sometimes with insomnia, you may have another sleep disorder. Sleep apnea, it's hard to say, like numbers wise, how many people are dealing with that, but estimated between 10 to 38% of the American population. So what do we know about insomnia? Nobody likes it. Lack of sleep is associated with weight gain, reduced immunity, high blood pressure, and depression. Insomnia changes our mood, our ability to perform, and it has health impacts. So how can we address this? Well, there's lots of factors when you look at someone who has chronic insomnia. So you've got three different sets of factors. So predisposing factors are like your biological traits. So maybe you're sensitive to sound or temperature or caffeine, or maybe you're a deep sleeper. Those are all biological traits. Some psychological traits. How dispositionally anxious are you? Are you prone to being a worrier? Are you reactive to stressors? And then we've got social factors. So do you share your bed? Is your bedmate disruptive? Are you on the same sleep schedule? Or outside factors, is your neighborhood noisy? You know, live by railroad tracks, something like that. And then you've got precipitating factors. So medical illnesses. So there's the cancer, there's the physical pain, possibly side effects of medications, things like that. Psychiatric illnesses, so any underlying depression, anxiety, anything like that. And then stressful life events. Once again, cancer comes up. Issues with family, work, grief, all kinds of things. And then perpetuating factors. So these kind of creep in over time due to the increasing insomnia. So spending too much time in bed, trying to compensate for a bad night's sleep the next day. And that's really conditioning yourself, right? You're building those associations where sleep and bedtime become frustrating and anxiety producing and restless sometimes. And then I want to touch on this too. So it can be difficult to distinguish between sleepiness versus fatigue. Fatigue is what we hear from patients is the most universal side effect of cancer treatment. It's physical, it's mental, it's emotional. It's not just I'm feeling sleepy. Generally, fatigue is not relieved by adequate sleep or rest. So even if you get your 8 hours and you're still fatigued, and that really is fatigue versus sleepiness. We see fatigue most severe during chemotherapy, after surgeries, or during or after radiation treatments. And we see gradual recovery of energy within about a year of treatment completion. So how do we address fatigue? Studies have shown, exercise during treatment, people report lower levels of fatigue. Kind of counterintuitive, right? How do you motivate yourself to exercise when you're tired? We also see research shows benefits in mind-body treatments for cancer fatigue, related fatigue. So mindfulness, meditation, acupuncture, yoga, all those great things that we offer here at Hearst can be very helpful. Let's see. So I'm going to go over each one of these individually, but we're going to talk about each one. Keep an open mind. I would hope that you take something home today that you'd be willing to try and see if it's helpful to you. So, consistent schedule. Consistency is key, right? We have set a bedtime, set a wake time, and keep it consistent. Make sure you're giving yourself enough time to get that 7 to 8 hours in at night. So if you stay up till 2 a.m., that may not work so well. Avoid social jet lag. So what I mean by that is sometimes we do different things on weekends where, you go to a dinner party and you stay out really late, or you eat late and you have wine late or something like that. So it's kind of similar to travel jet lag, where you feel kind of groggy and out of sorts when you shift your schedule during the week. And then the value of morning sun. We're fortunate to live somewhere where we do get morning sun most days. So get it as soon as you can. Have your coffee outside, eat your breakfast in a sunny window, do what you can to get that sun in the morning. And then natural light throughout the day. If you're working, take your breaks outside, try to exercise outside, take your dog for a walk, anything that will get you outdoors, gardening. Keep your curtains open and allow natural light to come into your home or your workspace. And then having a nighttime routine. So make sure you're allowing yourself time to unwind. So not just the time to make sure you get your 7 to 8 hours, but giving yourself about an hour to unplug before bed. That also will help exposure to artificial light. So all of us are watching TV usually at night, computers, tablets, whatever it may be. And you want to create positive associations, or like I said about the conditioning, you want to build those associations. So make it something you enjoy. Is it a cup of chamomile tea? Is it a good book? Is it a warm bath or a cold shower? Different things work for different people. Find what works for you and build that into your nighttime routine. And then I also want to say about artificial light. So there are studies, and I thought this was really interesting, comparing paperback book readers to iPad readers. So the light actually suppresses your melatonin production, which messes with your circadian rhythm, your sleep patterns. So they found that the iPad readers took longer to fall asleep. They had less REM sleep at night. They took longer to feel alert in the morning, and the following nights, their circadian rhythm was delayed by more than 90 minutes. So it doesn't just affect the one night that you decide to stay up late and read on your iPad. It goes into consecutive nights. Oh, that was very interesting. And then just another note, consider what are you filling yourself with? So are you watching an evening program that's stressful, the news, murder mysteries, try to just pay attention to what you're doing to yourself before you go to sleep. Okay, we touched on exercise, but just a few more things about that. So exercise can improve your sleep quality and reduce daytime fatigue. Even light exercise, a 10-minute walk, anything that you can get in, or stretching is going to be helpful. Why does exercise work? So exercise promotes our deep breathing, which contributes to the activation of our parasympathetic nervous system. So that's going to be your rest and digest and relaxation. The more vigorously you exercise, the more powerful the sleep benefits. But like I said, even a 10-minute walk is going to be helpful. They do recommend exercise at least 3 hours before bedtime. Avoid energizing or stressful activities 30 minutes before bedtime. And like I said, with your nighttime routine, engage in calming activities. So find what works for you. All right, before anyone gets mad, I'm not trying to take away your caffeine. 90% of Americans consume caffeinated products. The thing to remember is that caffeine has a half-life of 6 hours. So as you see on the little image here, if you are having your cup of coffee at 4, you're still going to have half of that caffeine at 10 p.m. Again, it affects people differently. Some people can have caffeine in the evening and still sleep well, but many people, are not factoring that into why am I not sleeping well. In an article from UCLA on caffeine sensitivity, research also shows older adults clear caffeine from the body more slowly than younger people. In one study, coffee drinkers between the age of 65 to 70 took 33% longer to metabolize caffeine than the younger participants. A slower clearance rate means the same amount of coffee that someone has habitually been drinking would have an amplified effect. So maybe when you were younger, you could have 3 cups of coffee. Now you're down to 1. So something to play with to see if it helps with your sleep. And also, there is caffeine in chocolate and green tea. Okay. So alcohol and other substances. alcohol, marijuana, and nicotine, all studies show it does not make you sleep better. I know a lot of people are doing the marijuana gummy things these days, but the research doesn't technically support it. But again, if something works for you, so be it. What we know about alcohol is it's initially sedating. So oftentimes people think that they need a nightcap, right? It'll help me go to sleep. Sure, it can help you go to sleep. It is sedating. But once your body is metabolizing that, you go through a withdrawal and overall you have poor sleep quality. You miss out on the deep restorative REM sleep. Another thing about alcohol is it's a diuretic. So you might be needing to get up 2 or 3 times to eliminate. And also alcohol is a relaxant for your muscles, which can lead to more snoring or irregular breathing. So if you have sleep apnea, it can worsen those symptoms for you. So if you are someone who enjoys a glass of wine or something, would just suggest having it earlier in the evening, give your body more time to process that. So maybe an appetizer instead of a dessert. And then with marijuana, there was a big study, a meta-analysis of 36 published studies to explore the impacts of marijuana on sleep. And they found the same thing, withdrawal was correlated with frequent sleep disruption. And the same with nicotine as a central nervous system stimulant. Yeah, I don't think there's more about that. Prescription medications, if you think something you're prescribed is affecting your sleep, I'd just encourage you to talk to your provider about that. Okay. So your sleep environment, assess your sleep environment and create changes for a better night's sleep. This could be limiting light, like we talked about artificial light, you could wear an eye mask, limiting noise. Some people like sleeping with earplugs or white noise, fan, things like that. There is free white noise on YouTube that you can put on at night, which can be helpful. Scents, some people are more sensitive to scent, so maybe there's an essential oil that works good for you at bedtime to make a lot of mists that you can spray on your pillow, things like that. Think about your mattress. I think you're supposed to get a new mattress every, is it 7 years? 10? I don't know. More than most people. So think about it, maybe a mattress pad or something you can add to your mattress if you can't get a new one. And then limiting your bed for sleep and intimacy only. So I think a lot of us get in a habit of bringing our laptop in the bed or working or writing or doing other things. So we just try to keep the bed for sleep and intimacy only. And then temperature, think about the temperature of your room. What do you think is the ideal temperature? Anybody want to guess? 68. 68. Ideal research shows 65. So anywhere from 60 to 68 is ideal. Put on the covers. Okay, let's talk about naps. I have this little quote on here. Taking naps sounds so childish. I prefer to call them horizontal life pauses. So naps can be very beneficial, especially if your body's needing time to heal and recover. So if you need a nap, what I would say is just consider the timing and the time and the duration. So research shows naps 20 to 30 minutes have been found to be the most restorative, about the effects of having 2 cups of coffee. Try to have your naps before 2 p.m. and that's assuming that you want to go to bed around 9 or 10. If you nap too late in the day, that's going to throw off your sleep cycle and you may not feel like you're ready for bedtime. So yeah, try what works for you. Keep a log, see what works best if you do feel like you're someone who needs to nap. Okay. So I think everyone experiences this kind of thoughts you wake up with at 2 a.m. What pops in your head, right? Things that you're worried about. Did I text that person back? Can I afford my treatment plan? I wonder if this ache is something I should worry about. You know, why is it taking so long to get my test results? I wonder what my family is thinking about all this. Sometimes your mind just goes, right? We also have thoughts at night about sleep. So we get upset. I must sleep. If I don't sleep, I'm going to be a wreck. My day tomorrow is already ruined. If I go to sleep now, I will get 4 hours of sleep. And you're watching the clock. Now it's 3. Now it's 2. Why can't I sleep? I'm so tired. Why does this keep happening to me? So all of these things are what we in psychology refer to as negative automatic thoughts, or NATs, which are very annoying. So this image just kind of shows you how the NATs and the other things we've talked about kind of all cause insomnia, or the impacts. So those NATs cause arousal, cause anxiety, emotional, and maybe emotional, cognitive, or just physical alertness. And being aroused and anxious at night is not compatible with sleep. Some of the NATs we talked about also cause that maladaptive habits where we're spending too much time in bed, or we have an irregular sleep schedule. So the consequence, again, of all of this with insomnia is we don't feel good, our mood suffers, we're fatigued, we can't perform as well, all those things. So what do we do about NATs? So one thing we can do is positive self-coaching. The first thing, though, you have to identify those NATs. So you have to, and this could be something you can do on your own, or if you see a counselor or therapist, they can work with you. So identify those and replace or respond to them with more helpful thoughts. So it's very intentional. So these would be some positive self-coaching examples. If I can't sleep tonight, I will be okay. I can get through tomorrow. If I don't get a good night's sleep tonight, that will mean I will sleep better tomorrow night. Many people are able to perform well with limited sleep, like doctors, shift workers, just normalizing that for yourself. And waking in the night is a normal biological process for many people. I do not need to view this as problematic. And how I feel tomorrow is also related to what I tell myself about sleep. So again, super intentional. You have to really think about what's going through your head at night and how to respond to that. Another useful tool is the 3-minute worry rule. So this is a book by Robert Leahy, and he talks about anxiety. Well, he talks about how worry, like anxiety, can be adaptive. So it can help us solve problems and see next steps. So he suggests allowing yourself 3 minutes to worry and asking yourself these questions. Am I closer to a solution? And do I feel better having thought this through? If the answer is yes, you've likely been engaging in productive worry. So if the worry is productive, you're closer to the solution, you've got action steps, and you're coping with the worry, and you feel better about it. If you do not feel closer to identifying any helpful steps and you feel worse, you are most likely engaging in unproductive worry. And what can we do about that? You have to deliberately turn your attention to engage in something else. At night, what could that be? Maybe it's calming music. Maybe it's deep breathing. Maybe it's listening to a guided meditation, something that will deliberately get you off that worry and focus on something else. So just labeling the worry as productive or unproductive will help you disengage in that NAT, that negative automatic thought. Okay. Relaxation techniques. So mindfulness is the practice of non-judgmental awareness of the present moment. It does take a lot of practice to be mindful. We have a mindful meditation group here at Hearst. You're welcome to join. It's just a 30-minute group, I believe, once a month, but can give you some helpful guided mindfulness that you can use on your own. There's also a lot of free apps for mindfulness, and a lot of insurances are also paying for things like that, like Calm or Headspace, things like that. But there are free ones out there as well. Another tip is have a notebook by your bed to write down your worries or your to-dos. So sometimes that thought at 2 a.m. was, oh, I hope I don't forget to do this, that, or the other. If you have your notebook handy, you can jot it down and you don't have to worry about forgetting. Another technique is gratitude exercises. This is really a shift in your mindset. It can produce calming and positive feelings. So it can be as simple as you're at your bedtime routine, you add, I jot down 3 things that I'm grateful for. You can make it as simple or as involved as you want to be. It's also a nice thing to share with a partner if you have someone you're sharing your bed with. And then diaphragmatic breathing. Most of us engage in chest breathing, which is shallow. So taking the time to use your diaphragm in your breathing can help calm you, and like we talked about exercise before, can activate your parasympathetic nervous system. So very helpful to do before bedtime or during. And then progressive muscle relaxation. I have some handouts. I'll give you one. It's an exercise to reduce stress and anxiety. You basically tense and release each muscle group and you go through your whole body. Can be very helpful, especially that's a very good one if you're up at night and need something to think about to get back to sleep. Probably fall asleep about midway. Okay, I want to touch on nutrition. We do have a registered dietitian at Hearst, and she'd be happy to meet with anybody who needs advice and guidance on nutrition. But how nutrition impacts sleep. So there's the main research, the chrononutrition is about meal timing and frequency. So for example, eating dinner within 2 hours of bedtime has been shown to lead to poor sleep quality. That's because of the relationship between digestion and your gut, your microbiome, and your circadian rhythm. So a lot about timing. So the time restriction with eating shows better sleep outcomes. A high protein diet, essential with amino acids, low glycemic index foods, certain foods rich in antioxidants can also contribute to better sleep quality. Tryptophan, an amino acid, is necessary for serotonin synthesis. So you can get your tryptophan through whole grain cereals and high protein diet, animal products, nuts, and seeds. The 2 most recommended diets are going to be your Mediterranean diet and the DASH diet, which I think most people know, but DASH is dietary approach to step hypertension, similar to Mediterranean, and it's low in refined carbs, low in sugar, low in salt. So basically no fun, but you will sleep better. And then you want to limit reflux-inducing foods, so fried, fatty, and spicy before bed. And then there's also food examples with melatonin, milk, pistachios, tart cherries, mushrooms, fish, and eggs. So all those food suggestions really fall under that Mediterranean diet as well. If you need a bedtime snack, or you're someone who wakes up at 12:30 being hungry, or maybe you're nauseated, those are just some suggestions there. Some warm milk, banana, plain popcorn, or herbal tea. So no caffeine, not decaf. All right, medication. So I would suggest before people jump to asking their doctor for medication is address all those underlying causes like we talked about. Look at your sleep hygiene, look at your schedule, look at your sleep environment. Are there other issues that are causing your sleep? Are you depressed, anxious? Do you have sleep apnea? Is there an issue with pain that could be addressed? And then consider cognitive behavioral therapy. So some of those, we talked about negative automated thoughts. Those are things you can address in therapy or counseling with someone before jumping to needing medication. There are non-addictive medications that are quite commonly used, trazodone and gabapentin. We hear gabapentin a lot with people with diabetes or people who have neuropathy. Can be very helpful for sleep if that's the issue. Habit forming sleep aids. You've probably heard of Ambien, Lunesta. Those are big name ones. And then benzodiazepines are Xanax, Valium, Ativan. Those are going to be if your issue is anxiety at bedtime. So, and these are all notes from psychiatrists. And I also would suggest, as well-meaning as your oncologists are, see a psychiatrist if you are wanting sleep aids. They will have very good recommendations for you. Okay. I want to touch on melatonin. So melatonin is a hormone. A lot of people don't know that. It's not an herb or a vitamin. It's also not regulated by the FDA. So it can interact with the medications that you're taking. It also can have additives that are not on the label, and the dosage may not be accurate. There was a 2023 study in JAMA. They found 22 out of 25 melatonin supplements were mislabeled. The actual dose did not match, and the difference was between 74% to 347%. Huge difference. So you really want to look at the product. If you do want to take melatonin, let your doctor know, of course, but look for the USP logo or know what kind of company you're buying from. And there are FDA regulated, there is one melatonin receptor agonist that is FDA approved. You should have to talk to your doctor about that. Okay, so because we're talking about sleep, I wanted to throw in a little bit about hot flashes. In general, hot flashes, we see postmenopausal women, but we also see patients who are on hormonal treatments for their cancers. They last an average of 3 minutes, and they affect 75 to 85% of women around menopause. 61% of postmenopausal women report insomnia symptoms as well. And maybe your total sleep time may not suffer with hot flashes, but your quality of sleep does. So how to cope with hot flashes, just a few suggestions. Dress in lighter sleepwear, use a fan or air conditioning to improve air circulation. Avoid caffeine, alcohol, and spicy foods. And then try those relaxation and cognitive strategies to help you fall back asleep. So we can't stop the hot flashes. We have to cope with them. Lucky us. All Okay. So some other resources, like I've mentioned, mindfulness, we do have our mindfulness group. And also the apps, like I mentioned, Headspace, Calm, Insight Timer, I believe is still free. And then a patient told me today about one called Balanced, which I haven't checked out, but she said it was really great. And then some wellness resources, you know, we've got our classes for yoga, Tai Chi, Qigong, energy balancing, acupuncture. And then Cancer WellFit, if you don't know, is a program through the Avila Bay Club and also the Paso Sports Club. And they do for patients 10 weeks of free exercise training. Really nice program.
When you work you hard enough, get you sleep really fast.
See, there you go. Yeah. And then Cancer Support Community, they're up in Templeton. They have a lot of great wellness resources as well. And then a sleep specialist, I just put that as a resource too. You know, if you feel like your primary care or your oncologist is just not really getting that you are having a significant issue with sleep, ask for a referral. See a sleep specialist. Make sure there's not a sleep disorder or something, or sleep apnea or something else that's going on. Something that you can do about it would be great. Okay, so I just encourage you, what is one change you will make or one approach you will commit to trying this week? And I talked very fast. Those are just some of the references too.